Hey, everybody. It's Carlos Rodriguez, La Positiva podcast. Just wanted to thank everybody for all your messages. I am seeing all the messages on the Positiva podcast. The first two episodes were awesome. This episode's also going to be a great one. I want to thank Dr. Umar Haque, who is also an author, Dental 101, the 101 factors you should know before going to the dentist. Had a great conversation with Dr. Haque about the importance of oral health, the importance of maintaining the oral health, and even probably more important is just beginning the beginning of it and the maintaining of it, and just how important it is to have your oral health in check in order to do everything that you want to do in your professional life and your private life, of course. Want to thank Dr. Haque for his gifts. I got Dental 101. Also gifted myself and my compadre Fry the Quran. Thank you very much for that. Greatly appreciate the gifts. And I hope that you guys greatly appreciate this conversation and that we can at least motivate you guys, if you haven't yet, to go and get yourself checked out. Dr. Haque is a graduate of UConn University out there in Connecticut. He did his residency at University of Illinois and University of Chicago. He currently has his private office out at Oakbrook Terrace called Oakbrook Smiles. And he is 1,000% recommended by us, by me. I am one of his patients, and I cannot say anything that is negative because everything about him and everything that has his name on it is nothing but positive. I hope you guys enjoy this episode as much as I enjoyed my conversation with him. We also get into a little bit of a religious talk, which I love to talk religion and origin. So I hope you guys really do enjoy this. I plan on bringing back Dr. Haque for future conversations about various topics. He's a man that has tons of knowledge, has tons of experience, and I can't wait to have another great sit down with Dr. Haque. But for now, enjoy this amazing conversation with Dr. Haque. Thank you very much. La pura positiva. I'm not a big guy on politics either.
It's okay.
But I love talking about politics.
All right. All right. Yeah, I used to talk a ton about politics and never did anything about it. So jumping into it now.
But you've always been political or not really?
I have not always been political. Like I thought about politics over the years. I've always been discussing it with friends and family and whatnot, but it really hit ever since what happened in October 7th and beyond with what happened in Palestine. The way America handled it. I just felt like, listen, you got this oppressing Russia invading Ukraine, and everyone's behind Ukraine, right?
Right.
And they're backing them up. But then you have this oppressive force of Israel attacking Palestine, and everyone's backing the oppressor. And it didn't make sense to me. I'm like, what's the deal? Mm-hmm. Why aren't you backing the people that have nothing? I mean, they literally had nothing. They had no water. They have no medicine. They have no electricity. They've got nothing. They don't even have a military force of their own. Mm-hmm. And these poor people, they're starving to death. They're eating grass. I mean, they got nothing. And we're supporting the oppressors. It just didn't make sense to me. And that's when I started getting involved.
That's when you decided.
That's when I changed. Yeah,
check some political.
Yeah, little checks and balances. You know? And so we there was a group of us in Lombard, small town, west
Beautiful
suburbs.
Town.
It's lovely. It's lovely. It's right next to our office.
Yep.
Yeah. That's where I live.
And then what I was thinking about is, or what I had a little bit of curiosity in the beginning, because I'm like, well, how am I going to start this, right?
Yeah.
Because
start wherever you want.
I don't have much expertise in the dentist world, but I was wondering. I'm more of a curious. Thinker as far as like, how do you're not originally from Chicago, are you?
No, I grew up on the East Coast.
Yeah. I thought I remembered that you are from Connecticut.
That's correct.
So how does Dr. Haque end up in Chicago out of all places?
Man,
This is where you did your schooling, or?
I did my residency. Yeah,
Okay,
I did my residency at University of Chicago, University of Illinois, Chicago.
Yes.
So, but that brought me here. But initially, what really brought me here, my wife. She grew up in Carroll Stream. She was born in India.
Okay.
But came to Chicago when she was a month old with her parents. And her family lived in Chicago for a number of years, and then they moved to Carroll Stream Illinois,
Okay.
and also further west suburbs. And after living there for a while, she got into college in Boston. So she went to college in Boston, and then she did her master's at UConn and at Yale.
Nice.
And her roommate was in my dental class.
Okay.
So
that's how the hook
that's how we met. We met at a
Oh,
party, and
out there at UConn.
at UConn, yeah.
Oh, wow.
UConn. Yeah, I was in UConn Dental School,
Okay.
and her roommate was one of my class fellows.
Yeah.
And we met at a party, and slowly things developed and started, hanging out, and eventually got engaged to her.
Yeah.
Like a year and a half later or so, and then we got married right after I finished. Actually, a week before finishing dental school. But by then, I already knew I wanted to check out Chicago and do my residency here.
Yeah.
And moved out here, and I loved it.
Nice.
I loved it. Yeah.
And then even if I take you before that,
Yeah.
like, how did you come up with the idea that you want to become a dentist? Is this like a
Great
family
question.
thing?
No, so a lot of people in my family are physicians.
Okay.
And some lawyers and engineers. I'm the first dentist in my
No
family.
pressure, huh?
No pressure.
Yeah, no pressure at all. Jesus.
Yeah. My dad used to be like, Omar, you're going to be a doctor or you can be a garbage collector. I had two choices. So,
Well, I guess I'll do that, huh?
yeah.
Wow.
So I ended up actually in the middle of college. I was in sophomore year and I got my first B in a genetics class. And my dad, yeah.
Your first B ever? Or what do you mean?
Ever
What?
in college.
Right,
college,
right. Okay.
So in high school, I think I straight A's. But anyways, my dad, when he saw that B on my report card, they don't call it a report card in college.
Yeah.
But when he saw that B, he's like, you're done. I'm sending you to Pakistan to go to medical school.
Wow.
My uncle, my dad's youngest brother, he was a surgeon, and he was also a professor at this school called Buckeye. And so I got shipped off in 97, halfway through my sophomore year of college, shipped off to Pakistan to go to med school in Pakistan. So,
What?
yeah, and it was fascinating. I go there for a year, and I'm doing pretty well, but one thing that I learned there, honestly, is how to memorize. Over there, everything is about memorization, rote memorization.
Really?
So yeah, it taught me how to study, I
Right.
think, more than anything. And I also got a big, sort of slap of reality. Over there, it's a tough world over there.
Little humble pie.
Big time. I mean,
Yeah.
I had a big slice of humble pie.
Yep.
It just really taught me a lot about, the world. And, it was tough over there. They see this American kid. I didn't belong either way. I didn't belong in America because I'm a Pakistani brown Muslim guy. And I didn't belong in Pakistan because now they look at me as this American. I'm a foot and a half taller than all of them, probably 100 pounds heavier than all of them.
Yeah, yeah.
And they look at me like a foreigner.
Yeah, you got
Right.
the good life in comparison, right?
I guess, right?
Yeah.
So I go over there, and the language that they speak over there is Urdu. And my Urdu is like kindergarten level.
Okay.
Because I moved to America when I was 4 years old. So I'd gone to preschool in Pakistan. So my Urdu, terrible.
Yep.
So I'm speaking in English most of the time, right? But thankfully, the school is taught in English. But everyone speaks, in general, in Urdu.
Okay.
When they're out, in the
Yeah.
canteen.
Everyone's
which is the
hanging out.
cafeteria.
Yeah.
Yeah. When they're hanging, they're chilling, whatever. It's mostly Urdu. But there's a lot of people at Buckeye that are from America, from Australia, from England, from Saudi Arabia, and they're all English-speaking primarily.
Okay.
So those are the people I sort of gravitated towards and hung out with them more, right? And ironically, one of them lives in Westmont, Illinois, and I'm friends with him still to this day. Great guy. Long story, I'm there, and towards the tail end of it, things are not going well. There's this group of people. There's a lot of, like over there, the political world in Pakistan is actually gang warfare, in essence. So I got on the wrong side of a couple of the guys there and woke up in the hospital, and my dad's like, you're coming home. So,
Oh, wow.
Yeah.
And how long was that? Like, how
So I
long were
was
you
there
out there?
I was there for 1 year, exactly.
A full year.
Full year in 97. Now I get back, and I'm still thinking medicine, right? And I start rotating at different hospitals with a few physicians, a few uncles, a few other family friends. And one of them was an oncologist. And I was rotating there, and one of my friends, unfortunately, had leukemia.
Okay.
And when my uncle was doing his notes, I would sit back and I was playing checkers with this kid, right? And a few days later, he ended up getting a bone marrow transplant, and he got this thing called graft versus host disease. And he passed away, like not even 24 hours later.
Oh.
And it broke me. And I was like, I was weeping, I was crying. My uncle comes up to me, he's like, you should do dentistry. Like, honestly, condescendingly.
Yeah.
And I was like, what? And he's like, think about it.
Yeah.
And so I was like, whatever. And actually that summer I started rotating with one of my best friends in high school. His uncle's a dentist. So I started rotating in his office and I loved it. I was like, this is awesome.
Yeah.
And so I started, the process, started the journey there and haven't looked back since.
You know, that's ironic that you share that story, because one of the things that I kept going over and over in my head, like, where am I going to take this conversation? And especially now with the whole, I'm sure you've seen the guy that got assassinated from United Healthcare.
Yeah.
And I started thinking, like, man, that's the huge responsibility on doctors, on dentists, the well-being of the post surgeries and the post work done to them.
Yeah.
And the effect of what happens to the patient afterward. Like, how much, especially now that you share that story and how you wept and whatnot, how much does that how did you learn to keep that out of your psyche?
It's tough.
Yeah.
I mean, every time I give anesthetic to someone, I'm legitimately worried about their welfare.
Yeah.
I want to try and make it as comfortable for them as possible. Ileana, your wife,
Yep.
my assistant, right?
Shout out to my wife.
Ileana,
Yes.
you're the best. She does this amazing thing. So every time a patient comes in, she's really sweet. She nurtures all of our patients. She gives them a warm neck pillow. She makes
Yep.
it comfortable for them, right? But one thing she does clinically that makes such a massive difference is before we give anesthetic, she does this thing. She uses this specific kind of topical anesthetic. Topical means it goes literally on top of the gums, right?
Okay.
It brushes on with a long Q-tip, and it's got 3 kinds of anesthetic in it. And those 3 anesthetics combined do a really good job of numbing the gums before we give the anesthetic.
Okay.
So you don't feel that shot nearly as much. Sometimes a lot of patients like, you gave me the shot already? I was like, yeah.
I'm glad you brought that up, because that's, I think, one of the biggest misconceptions, period, is the fact that everybody thinks about that needle going into the gum and just being the worst pain ever, right?
It scares the life out of many of our patients. Absolutely. So there's a few things that scare most people. It's the shot,
The shot, yeah.
the sound of the drill.
Correct.
Okay. We haven't fixed that yet.
Yeah.
Unfortunately.
And that's going to be a tough one, I think, right?
It's not going to change unless we can find some reversal of the frequency. I've thought about this a lot, but I haven't figured it out yet. How they have, like, for headphones, right? For AirPods and for a lot of headphones, they have those noise canceling things, right?
Right.
What it does is it puts out the frequency that's exactly opposite of the frequency of what sound is being created outside.
Oh, wow.
And that's what helps, like in an airplane, right? I just drove by Midway.
Yeah.
Really cool.
Correct.
To see some of the planes taking off. But they have those noise canceling headphones that get rid of that airplane sound pretty well, right? But the way it does it is it gives you the opposite frequency, so it cancels each other out.
It literally cancels it out.
Right.
Yeah.
So if I could create something that had the opposite frequency of the drill sound, but the problem is the drill sound is right up inside someone's mouth, right? So I'd have to be able to produce that opposite sound in the same area.
Yeah.
I don't know, some sort of mini speaker that could be autoclaved. I don't know.
Something, yeah.
Something. It would be super cool. But that could help, theoretically, reverse that. But so it's the needle, the sound of the drill,
Correct.
and the idea that things are going to hurt, right? So those are the 3 major things. And sometimes, unfortunately, the cost.
Right.
That
yeah.
hurts too.
Yeah.
Right? Because dentistry is not cheap. Nothing in healthcare is cheap,
Yeah.
unfortunately. And it's weird because when we can get a lot of our patients, I mean, they're coming in, they're white knuckling their armrests.
They're sweating.
They're sweating. You can tell, oh man, those are the patients oftentimes will sedate as well.
Okay.
So we can sedate our patients too, which is nice. Sometimes we just use nitrous oxide, makes them high, basically.
Yeah.
It's like having, a couple
Is that
of those.
the infamous laughing gas?
That's
Is that what
the
it is?
infamous laughing gas.
Yeah.
The stuff.
So
it
does that,
works.
like, I've never tried it. I mean, does it work? Do they get, like, just pretty much high and they don't feel anything, or?
They don't care anymore.
They don't care,
They
yeah.
don't care. It's sort of like having, a couple of joints.
Yeah.
But it's a relatively quick onset and it's a relatively quick offset when you just switch it from nitrous back to oxygen.
Yeah.
it comes out of your system pretty quick. Within 5 minutes, it's out of your system.
Oh, okay.
So
Just to get the work done.
To get the work done.
Right.
Yeah, and for some people I know, it's the needle that's freaking them out. Even if it doesn't hurt, it's the needle that freaks them out. So if we can give them the nitrous through that part, then we'll slow it down afterward, because then they don't care about the rest as long as they're numb.
Correct.
Right? But some patients are scared of everything.
Yeah.
A to Z, the sound of things, the sound of the drill, the sound of, tooth coming out, whatever it is, we'll keep the nitrous on the whole time.
It's a lot of the patients thinking certain things might be painful, and then having their own. I think culture has a lot to do with it as well.
Yeah.
We spoke a little bit before we started about maybe just, I wanted to say maybe us Latinos, Mexican American, but I think in general it's just like, low income. I think that dental health isn't, or at least on me, it wasn't pushed. And I'm from Little Village, for those listening and watching. I don't think it was very much addressed, to the full effect that I think now as an adult, people with periodontal disease, they have no idea that they have periodontal disease, and do nothing about it because they don't know anything about it. They don't know any better.
The fact that you even know what periodontal disease is
Right.
a huge step, right? I mean,
Well,
it's awesome.
thank you to Ileana. Yeah, my wife helps me out with all that.
It's
yeah.
huge, so periodontal disease, right? It's that inflammation of the gums. It's the stuff, it actually causes bad breath, right?
Right.
It eventually causes tooth loss, because what periodontal disease does is it forces, unfortunately, indirectly, our bone to be lost around our teeth.
Okay.
Right? So it's gum disease. Some people call it gum disease.
Gum
Some
disease,
people call it pyorrhea back in the day.
Okay.
But what it is basically just inflammation, swelling of the gums, and it's caused by bacteria. And those bacteria, they're in there, and then our immune system wants to fight them, but our white blood cells can't make it out into the gums and onto the teeth. So they're shooting all kinds of missiles at these bacteria, but unfortunately those missiles are hitting our bone, and it kills our bone cells in that area. And so the bone slowly and slowly and slowly diminishes,
Right.
and then eventually the teeth get loose. And then at that point,
Is
it's
that where
too
you
late.
just start losing teeth?
Yeah.
Okay.
Yeah. When those teeth start getting loose, it's a bad sign.
All right.
Yeah.
And that's usually because of the gum disease, just having so much damage now to the bone. Is that the jawbone?
Exactly.
Okay.
Exactly. So once that jawbone starts to
Thin out.
decrease around the margins of the tooth. So what holds our tooth in place, if you imagine like an ice cream cone,
Right.
right? If you have a big ice cream cone, you can hold a good amount of ice cream in there, right?
Yeah. Yeah.
But if you have a really tiny ice cream cone, you can't hold a big scoop of ice cream on there, right?
Right.
That's what happens. Imagine the bone being like that ice cream cone. What happens is that ice cream cone is getting smaller and smaller and smaller, and you're trying to balance this huge piece of ice cream over it.
Yeah. There's nothing to
And
settle
scoop-
on there.
Yes, exactly. And then the ice cream is just wobbling and it falls on the ground, and kids crying.
And that's usually due to just not having not maintaining any kind of like brushing, flossing. What exactly? I mean, that's all preventable.
It's all preventable.
Yeah.
If you just go in for your regular routine cleanings, especially if you start at a young age and you maintain it, you're probably never going to get periodontal disease.
Okay.
But what happens a lot of times, people, you get comfortable.
Yeah.
especially-
So let's talk about like let's
Yeah.
just say somebody like let's just say mid-30s.
Yep.
Hasn't got. I'll be honest. When I went to your office, I hadn't been to the dentist in probably over 15 years, right?
Yeah.
And that's just a thing that I mean, I'm not ashamed to say it, or I just think it's something that we're ignorant, that we don't know any better.
Yeah.
And we grew up like that. And what is routine? When you say routine, what is routine? Like somebody that hasn't gone, let's make an appointment. Can you walk me through that?
Okay, so usually if someone hasn't gone for a long time, they're
Right.
coming in first. They're not getting a clean that day. Usually they're
Right.
they're getting diagnostics.
They're gonna
Okay.
go get checked out.
Get x-rays, get some photos, and go over the game plan.
Mm-hmm.
Okay, so one of the other things that my hygienist, Agnes, will do is she'll go through and she'll get these numbers
Right.
on the gums.
Yep.
So 1s, 2s, and 3s are healthy. What these numbers are a measurement of the gums in relationship to the bone. 1, 2, and 3 means, hey, those gums are pretty healthy.
Okay.
Right, 4s and 5s, or if there's bleeding when she's probing, we know there's inflammation. Imagine if you're washing your hands, right, in the sink and all this blood's in the sink, right? How many times do a lot of people brush their teeth and there's blood in the sink afterward?
Right.
That's usually because of inflammation. It's because of swelling. Now, if we're washing our hands and there's blood in the sink, we're going to freak out. We're going to go to the doctor, right?
Great point.
How many of us go to the doctor if we have blood in our spit?
Yeah.
Right? Not as often.
much.
Right? Not as
Yeah.
often.
Yeah, yeah.
Gum disease doesn't hurt. That's the problem too.
like
It
a
doesn't hurt
silent-
until it's too late. It's silent. It's a silent killer of teeth.
Correct.
The way in our heart, when we get plaques that build up in our heart, it doesn't hurt until
Until it happens.
until it's a heart attack.
Right.
Exactly. And that's why gum disease is a silent killer of teeth, just the way atherosclerosis or, blood vessel, lipid buildup is a silent killer too, right? They have that. There's one artery, and it's heavily related. They found a lot of those same bacteria in the heart that they find in gum disease. There's a strong relationship between gum disease, diabetes, heart disease, and stroke.
Okay.
And all three of those, it's not an exact one-to-one, but people that have uncontrolled diabetes will usually have really bad gum disease. People that have really bad gum disease are more prone to having diabetes, heart disease, and are more at risk of having a stroke. And for women, if you have significant gum disease, there's a lot of times problems with low birth weight babies and pregnancy issues in general.
See, these are all the things that, I'm glad that you're here. I want a lot of the people that do follow us and watch us to know the importance of having, I think it's just a matter of also just programming the kids, your kids, at an early age, that this is part of life. Just do it. Just get in there. It's not as painful as you thought. This is not the 1930s anymore.
No.
They're not going to give you a shot of whiskey to take out your back molar or whatever, wisdom tooth. Now I read a little bit into this, coming into this, just because I wanted to know what the, what kind of new technology it has, dentistry, how much easier it is now than comparison to before. And I just feel like a lot of our people still are not as aware as they should be.
Yeah. I see it in a lot of people. I see it in a lot of our immigrant patient population. We have patients that are Latino, we have patients that are African American, we have patients that are white, we have patients that are Indian, Pakistani, Arab. We have patients from all over the world, which is really cool. Chicago is that's one thing I actually loved about Chicago. There's so many different cultures and races and, foods that are available here because of the melting pot that Chicago is. There's so many different cultures here. And it's awesome. But with that comes a lot of relatively new immigrants too, right?
Right.
And with that, sometimes in some cultures, in some countries, dental health isn't very high in the priority list,
That's
right?
true.
Survival, right? Just, putting food on the table, right?
Yeah.
Where my family's originally from, it's dog-eat-dog world out there, right? And it's much more than America is. I'm very thankful to be here. But at the end of the day, our dental health has a big impact on our overall health too. Like we said earlier about diabetes and gum disease, heart disease and gum disease, stroke and gum disease. Now, cavities. Now, this is one thing. I'll tell you, just last year, there was an NFL player. You read this article, right?
I read this article.
It's crazy.
Great NFL player, by the way. Mike Williams, is that who you're talking about?
Yes.
Yeah, right?
He died from a dental abscess. Now, that's not from gum disease, okay? So there's two main diseases in the mouth that happen like the most often is gum disease and cavities, okay? So cavities, different kind of invasion. This is now in the actual tooth itself. So cavities will break down enamel, okay? And they usually start sometimes in the grooves of the teeth or in between the teeth. And it's a slow process, too. It doesn't happen overnight. It takes a lot of time. It takes years, exactly. But usually patients will show up with a cavity issue after it's late in the game. So if you look at a tooth, it's sort of set up almost like a cake, where the outside, the frosting is the enamel.
Okay.
The sponge cake is called the dentin, and then that fruit filling in the middle is the pulp.
Okay.
And so that pulp, if a cavity gets through the enamel, gets through the dentin and gets into the pulp, now it hurts a lot.
Is that where the infamous tooth pain comes in?
Exactly.
Okay.
That's where you get a legit toothache.
Okay.
And in the medical world, they actually say there's 3 kinds of pain that are the worst pains. One of them, labor. You and I are never going to have to deal with that.
No.
Okay? Second one.
I always give Ileana a hard time with that. Like, I have a cold. Now I know what you feel.
She's not buying that.
No.
She's not buying that.
She's not buying that at all.
The second one is a toothache. Okay, so tooth pain is right
It's
there,
right
in the
up
top
there,
three.
huh?
Top three.
Top
And then
three.
the third one that they gave was gallstones.
Oh,
Yeah,
okay.
those are painful.
Yeah.
I haven't felt that either yet, but you never know.
Okay.
But that's, those stones that happen in the kidneys and in the
Yeah, yeah.
bladder. Yeah, those are painful as heck.
Sometimes you kind of like pee them out, or
Hopefully,
yeah,
if they're small enough, you can pass them.
yeah.
But
Pass them,
sometimes you got to get surgery to get them out. Yeah, or they have to use some ultrasonic things to break them up.
And then what do you do once it does affect it that much? Is it time to like take out the tooth?
Most of the time, it is time. Once it's that late, it's oftentimes time to take out the tooth. Now, some people, they do the root canal thing to save the tooth. And
that's where I was
something
going
know-
next.
I know you want to talk about
Yeah.
that. Yeah. So root canal.
There's a stigma with that
There
as
is.
well.
There is. There was a whole movie made about
Yeah,
it.
yeah,
It's
yep.
called The Root Cause, right?
Right.
So there were 3 doctors back in the day. Okay, one of them was Weston A. Price, and then there was another guy named Huggins, and both of them were very much anti root canal.
Right.
Now, Weston A. Price, mind you, he was back in the early 1900s. He spent 25 years researching root canals, and what he would do is he would take out like root canals that were gone bad, take them out and test these teeth. And he found all kinds of different bacterial invasions from them. And, these bacteria, when they're in it, so when you get a root canal done, basically you get that pulp taken out. You get that fruit filling removed.
Yeah.
And then what goes in there? This thing called gutta percha, which actually comes from trees. See, you got a nice tree back
kind
here.
of a
It's-
Christmas
it's
tree.
nice.
Hey, by the way, also if you need us to bring anything up on the screen,
Okay.
you could just say it on, and they'll bring it out. Like, oh, can you pop
Okay.
up this? Or
Yeah, if you want to
just in
take,
case,
if
just
you want
in
to show a
case.
picture of what a root canal looks like, you can put that up. Yeah.
Yeah, so the people can also
there's
they'll be able to see it
lots
on
of
their
JPEGs,
end.
Yeah, lots
Yeah.
of JPEGs up there. Yeah, let's show you root canal, and just root canal diagram maybe. Diagram might be a better word. Yeah. There you go. All right, so that
People
let's
can
see
watch
here.
this, right, compa?
So that picture down, one down right there, yeah. So that one's pretty good. Or if you go to that show more images, further down, you just click that, yeah. Let's see here, we got a picture of, this is a cool picture, that black one right there. If you right click that,
That one?
yeah, you could do that one. It's not bad. Open link in a new tab, yeah. Or open picture in a new tab. Oh, but it has that weird background. My bad.
Yeah, compa got it. He'll get it right now. There you go.
Yeah, you could just zoom it in a little bit.
There we go.
That's not bad. That's good. Actually, yeah. Cool. All right. So you want me to talk about this diagram?
Yeah.
Yeah, let me talk about this
Let's do
diagram.
it.
Okay, so the enamel is that white part on the outside,
on
right?
The little,
Yeah, there
outside.
you go. And then the next layer in from there, that pinkish area, that's called the dentin.
Yep.
Okay, and then further down and in those linear areas, that's the pulp.
Okay.
And so what they're showing in this image here is 2 different sides, 2 different halves, and it's a progression. So initially, when a cavity starts getting in, it goes through the enamel, it goes into the dentin, and it goes into the pulp.
Right.
First, what you'll get is this thing called an inflamed ligament. That's the right side of the picture.
Okay.
And what that shows on an X-ray, it shows just like a widening at the end of the root,
At the tip of the root.
at the tip of the root, and we call that the apex.
Okay.
And when there's a widening there, we know there's inflammation, and we know that the pulp is angry. And usually at this point, patients, like sometimes they're not it's waking them up at night, sometimes it's throbbing and aching, and then eventually the nerve just dies. And that's when you start getting the abscess. And what the abscess is, and that's the other half of the picture, the abscess is actually,
Oh, okay.
yeah, the abscess is an inflammation in the bone, and the bone is basically creating like a quarantine zone. It's trying to block off the infection from spreading into the rest of the bone.
To not get inside the bone
To
or
get
the rest
further-
of it?
Yes.
Because it's already on the bone.
It's in the bone already.
Yeah,
It's
so
made
it-
its way,
It's kind of doing its own thing to protect from the rest of the bone.
and the rest of the body. And here's the problem. A lot of times after root canals, that abscess never goes away. Because back in the day, especially, when they would do root canals, they didn't clean everything out properly.
I would imagine, yeah.
And here's the reality also. Our roots aren't just linear. If you look carefully at that picture also, you'll see some little side tracks.
Yeah.
There's thousands of them in every tooth.
Kind of like little veins in a sense.
Little tributaries, little access
Other
points.
roots, yeah.
Little roots, exactly. So if you look at a tree, right, and you see a branch,
Right.
you see the main branch, that's what the root canal does, is it cleans out the main branch, but it doesn't clean off the little
All the other
little branches
thing,
on the
yeah.
side. Yeah. So the problem and what Weston A. Price claimed was, hey, look, these roots are not really properly cleaned.
Right.
And they're not really completely sterilized. The goal of a root canal is to sterilize a tooth, okay, and to make it so that we can keep the root as basically an implant. And then you put a crown over the whole thing.
Okay.
The reason being, after a root canal is done, the tooth becomes completely dehydrated. It no longer has any blood supply in it. It no longer has any water in it. And you know what happens to things when we take the water out of it?
Yeah. So it's like a dead spot.
It's a dead tooth.
Yeah,
It's a dead tooth, yeah. And so his whole thing was, this affects the rest of the body. You know, he was claiming in this movie, and actually in his research, that a lot of times, if there's a cancer, it's going to start on the same side of the body that the root canal's done.
Interesting.
Like specifically breast cancer. He brought up a number of scenarios where breast cancer was found on the same side that a root canal was done. So, like the holistic patients, we have a lot of holistic patients at our office.
Yeah.
They are dead set against root canals. And so for those patients, we take teeth out. If the cavity's in the nerve, tooth's coming out. And then we're talking about either an implant there or a bridge in that area. Or sometimes just leave it empty. Especially if it's like a last
Like in the
tooth.
back?
Yeah,
Yeah.
all the way in the back, yeah.
And this is it all starts with a cavity?
It all starts with a cavity. It all starts
Oh,
with bacteria. Just bacteria. Little invasion.
Yeah.
But it just takes time and it spreads
And at the end of the day, it's pretty much all sugars then. Is that what it like? Is that the majority of the big factor there or no?
So there's 5 factors to create a cavity. You need it's like a recipe, okay? So like to make anything like in the kitchen, right? We need a certain number of ingredients to make something, right? To get a cavity, you need 5 things. You need the bacteria that cause the cavities. You need sugar. You need time. You need acid. It needs to be an acidic environment.
The acidity, huh?
That's one thing that if you see a lot these days, there's a lot of these water bottle companies making alkaline water.
Yeah.
Right? So alkaline water actually does change, it does change the entire like the balance in the mouth. So the way it does is it's, so low pHs, anything under 7 is acidic, anything over 7 is alkaline. Okay, so water is right in the middle. Normal water, like our tap water that we get from Lake Michigan, it's right there at 7. Now, acidic things like we're drinking Diet Pepsi here.
Yeah.
So Diet Pepsi is acidic,
Right.
but it's no sugar, no real sugar in it.
Right.
But things like Mountain Dew, regular Coke,
Dr. Pepper.
you name it, any soda, juices, most juices, very acidic, like oranges.
Oh, man.
They call it citric acid.
Yeah,
right?
yeah.
So it's acidic. Lemonade, almost any drink is acidic.
Right.
Okay, so except for like milk is more alkaline though. Milk is alkaline. These alkaline waters are alkaline. Malox is alkaline. You're not going to drink that.
Yeah, Malox. I forgot about Malox.
God.
Wow.
Yeah. Milk of magnesia.
You took me there. You took me back there. I forgot about Malox.
Yeah. So when it gets to that point, what the argument is that was made in root cause, going back to root cause, right? So the argument that they make is that if you don't really clean that tooth out properly, which they claim no one ever does, and it's sort of true that you can never get to those little extra branches, even with today's technology.
Yeah.
You can't physically clean those.
There's always going to be some leakage in there.
Some. But what they do today that's a lot different than before is they use a lot of different reagents to clean out, like they basically bleach. They use a bleach-based material to really, really irrigate and cleanse the inside of the tooth. What happened with Mike Williams, though, that abscess spread. And it spread to the lower jaw into this area called the submandibular space, and then it spread to the neck, and then he basically, sadly, choked to death on his own abscess. Yeah.
Gee,
So it blocked off his airway.
Young guy, professional. I mean,
Athlete.
beast of an athlete.
Yes.
Yeah.
So
You would never think that.
No way. No way. In America, 200 years ago, leading cause of death was dental infection.
Really?
Yeah.
I mean, I can only imagine 200 years. Like,
that
how
long.
do it's not that long ago. It's only 3 grandparents away, probably, or something like that.
Yeah, you go back a few generations.
Yeah.
That's it. It's not that long.
Yeah.
It's not that long ago. Yeah.
So there's ways to go. Do you feel in the whole dentist world? I mean,
think so. There's still a lot. There's still a lot to be done. The idea of stem cell therapy. It's already starting to happen.
yeah,
There's
yeah.
already research being happening.
Four teeth,
Yeah,
like to
extra-
regrow,
regrow teeth. It's
Yeah, I heard
happening.
about
They're
that
doing it in
too.
Japan already.
What?
Yes, on mice.
Yeah.
Not on humans
starting,
yet, but it's
yeah.
starting. It's starting.
The concept is there.
The concept is definitely there, and what they're using is different stem cell therapies. And one place that we have our own stem cells is, of course, our umbilical cord.
Okay.
So a lot of people are, cryogenically freezing umbilical cords. But the other place that we actually have some stem cells later in life is when we take out wisdom teeth. If you take them out early, there's this sac that's over the wisdom teeth.
What?
And that sac has tons of stem cells in it.
Really?
Yes. So people are freezing those now as well to see what happens in the future.
What is considered taking them out early?
Like early enough that they have not erupted all the way.
Ah, okay.
Okay. So like usually for males, it's around age 16 to 17.
Okay.
For females, it's like a year or two earlier.
Okay.
Women just develop a little faster than
Now, wisdom teeth, I'm glad you brought that up because I was also looking into that. And technically, not too long ago, I believe that wisdom teeth are technically used for nothing now, right?
in essence. Now,
Yeah.
because, we cook our food and stuff. If you go back in time.
Yeah, we don't have to eat on that hard meat now.
Where they barely cooked it, right?
Yeah.
It was different back then. And they ate a lot more raw than we do, right?
Nuts and meat, raw meats and
Absolutely.
fish and whatnot.
Absolutely. Very different diet if you go back in time, right?
Yep.
I'm talking like
Hundreds.
hundreds of thousands, maybe millions of years ago,
millions
right?
of years.
So if you look at and this is where
Because even the jaw structure is different.
massively different.
Our brain now is bigger as well,
yes.
so it affects the jaw size.
Takes away space
Yeah,
for that.
space,
Yeah,
correct.
exactly. So, and now most of our jaws don't fit our wisdom teeth. So a lot of times when wisdom teeth are starting to come in, they're starting to cause crowding of teeth, and that creates orthodontic issues. And we're all vain, right?
Yep.
In America, we want our teeth straight and white, right?
Yeah.
But what happens when wisdom teeth start coming in? It's like the annoying guy in the back of the line that's just like shoving everyone. It's like, come on, guys, move ahead.
Yeah.
That's a wisdom tooth.
That's
It's
good.
annoying, and it's just coming in, and a lot of times when it's starting to come in, it gets infected around it because it's really hard to brush and clean.
I was talking to Dan about this. I don't know if there is. You can correct me if it's been tried, but I don't see why it shouldn't be almost like not a mandate, of course, but something like, hey, when your kid turns 16 or whatnot, you should take them out. Like it just gives it's healthier. It'll be a healthier mouth in a sense.
So that I think mandate would be hard to do, obviously, right?
Yeah, not mandate,
but a lot of times patients that are going in for braces, they already know that their wisdom teeth are going to have to come out, or people that just go routinely to the dentist. Their dentist will usually tell
take
them,
them out.
yeah,
Yeah.
they'll talk about it.
okay,
Yeah,
okay.
there are patients that the wisdom teeth fit, and often and a
They'll
lot of
leave 'em
times
there.
we leave them alone.
Yeah.
I'll have patients that come in, 58 years old and still has all of his wisdom teeth, and I look in his mouth and they fit and they work, and he's keeping them relatively clean.
Yeah.
Hang on to him, man.
So
At that point, it's actually more traumatic to take them out too.
later in life,
Later in life, yeah. That
Yeah.
bone gets much more dense, and then there's potential for complications and whatnot. Yeah. Yeah.
nothing a little laughing gas won't take. I'm gonna go back again to when you left UConn.
Yeah.
And you came to Chicago to the Midwest. How was that adjustment for you? Like, were you here for a while before you opened up your first practice? And,
Yeah.
How did all that go about?
Yeah. So I went to University of Chicago and UIC for a residency.
Right.
Right. And so in that residency, it was hospital based. So we got a chance to really work on patients with some really complex medical histories. We worked at La Rabida down on the south side. And
Okay.
man, we worked on some poor kids, man. That was the hardest rotation that I ever went through, because we worked on kids that were quadriplegic, blind, and deaf, and they didn't know what was happening to them. And and they wouldn't sedate them. The state wouldn't pay for it. So we just had to hold them down. And so we had 3 of us working on each patient. And so like one would get the legs, one would get the arms, and then the other one would be holding the head sometimes, and we just have to try and clean their teeth, or whatever we could do that day, we did.
Right.
On those patients, and it was exhausting mentally and physically, and I felt bad for them, honestly. But after I was done with that, I knew I didn't want to deal with too many kids anymore either.
Right.
So I
It
decided
filters
to go
that out. Yeah.
I decided to go to more adult dentistry.
Yeah.
And so my first job after residency was with a big group called Heartland, and it was out in the Quad Cities, right on the border of Illinois and Iowa.
Okay.
And I was in Rock Island, Illinois.
Oh, I know.
You know-
I mean, I passed by Rock Island.
No kidding.
Yeah.
Yeah. It's right on the Mississippi River.
Yeah, yeah.
Beautiful area. There's like 3 casinos there, and that's the only thing there is to do.
That's the fun part.
Yeah. I guess. There was a really cool comedy club there called Penguins. And
Okay.
so we'd go there a lot. It was a fun time.
Nice.
Yeah. So I worked out there for like 8 months and realized I don't want to live here anymore.
Yeah.
And I want to get back to Chicago. I love Chicago. And found a practice that was for sale. There was a guy selling a practice right in Oakbrook Terrace. So I came out here and looked at it. I liked it. I put an offer in, and he accepted it. And here I am 22 years later, same practice.
22 years. I was going to ask you, how long have you been there?
22 years now.
It's
yeah.
Oakbrook Smiles we're talking
Oakbrook
about.
Smiles. Oakbrook
Yeah.
Smiles. Yeah.
22 years. Congrats on that, man.
Thank you. Thank you.
Congrats on
It's
that.
been great.
And I mean, when you were dealing with all the kids in the beginning,
Yeah.
and now obviously you don't do the kids, but you obviously have
I did
your
at the beginning.
patients. In the beginning, you
I
did.
did.
What do you do for Umar? What do you do to kind of like get your psyche, to kind of come down from that adrenaline, or maybe not adrenaline, but just like all the hurt from the kids and whatnot?
It's tough.
Yeah.
We have to manage the kids. If I see a kid going through a hard time, there are times where we just, we throw in the towel and we say, what, not today. But there are also times where like, okay, hey, Ileana, turn on the nitrous. Let's go.
Yeah.
And we'll get them through it usually. Nitrous does change the game. Honestly, it's a game changer.
Yeah.
But also sometimes for like adults that are really scared, I'll tell you, the most stressful thing about dentistry is patients that have a hard time with it. It is. But it's very rewarding as well. There's so many patients that are so appreciative of the care. We have patients that come in and like their teeth are really bombed out, and we change their lives. These folks, they've never smiled for like 30 years.
Yeah. Embarrassed to crack a smile.
And now they're smiling ear to ear. They go, and you see the change in them. Now they're like, for some of our female patients, now they're wearing makeup, they're dressing up different, they're losing weight. It's amazing to see the transformation that it makes for them.
Yeah.
Like here.
It's a
as well.
psychological
It
thing,
is.
man.
It's massive.
Yep.
It's massive. It's beautiful. It's a beautiful thing to see the change in a lot of our patients. And then we have other patients that are just more, health conscious and really appreciate that. So that's really cool. But what's also very encouraging is the patients that used to be, nervous in the waiting room even, and now they're coming in, hey, how you doing? And they're chill now.
Yeah.
Because they've been through it enough times now where they understand how it works, and they're good. They're good.
Yeah.
And it works great. It's
Well,
nice to see.
you have a very welcoming office. You do have a very
Lucky.
a great staff.
Great. Amazing.
yeah, amazing staff.
Amazing.
But just walking in there, it's not your what we back in the day would imagine a dentist office to be, right? It's just very welcoming. You have your little waters and your coffee and your books, and it's not overwhelming at all. It's not intimidating either, and I think all of that helps. The little neck pillow also helps. You're there. It's the first time that I've ever gotten like a neck pillow at dentist, and Ileana like puts chapstick on your lips while you're getting work done. The whole thing. It's great. I love it.
I'm glad
Yeah.
you love it. I'll tell you, I can take zero credit for any of those things. That's the ladies. That's
Yeah,
the ladies that do all that. It makes it for a much more comfortable experience.
So 22 years in
Yeah.
the aspect of the business is the most. Would you consider having the right team one of the most difficult things to accomplish in business?
Absolutely, having the right people makes all the difference in the world. If I had if I had team members in my office that didn't love what they do,
Yeah.
patients wouldn't love coming. They wouldn't. Patients see that clear as day. They know that everyone is out here to help them.
Right.
And that's our goal. Our goal is to help our patients.
Yeah.
Yeah,
because the more and more I've sat with business owners and whatnot, I think the number one factor or complaint is just the difficulty of having every member with the same exact vision and be on the same page. And I've always said it doesn't matter what kind of business you're in. I believe we're in a world of customer service, regardless of your profession. I mean, being nice, being cordial to people goes above and beyond any type of business you're in.
I think you're right.
Right?
Absolutely. I mean, that relationship,
Correct.
it's truly a relationship. We call it, patient-doctor confidentiality or patient-doctor relationship. It's very important. It's so important because, and it's not just patient-doctor, it's patient team. Like everyone, these patients, they come in, they tell us about their lives. It's funny what happens when you recline that chair, the things that patients will tell us. They just, I don't know. I'm not a therapist. I'm not licensed as a therapist by any means, but there's so much that they come out and we talk to our patients. It's not just about teeth. We have real relationship, life. Yes.
Yeah, you have patients all ages. Dana tells me there's, elderlies that have been with you guys forever.
Yeah.
They've known my son from pre-Gael to now Gael. I mean, everything. And all of that, I believe that I tell her, like, look, these are the people that you take care of in business and life because these are the people that, you're taking care of them and they're going to keep taking care of you. They're going to keep coming back for that. It's a rewarding system in a way.
It is.
Yeah.
It is. And those are the best patients that we get are referrals from the patients that love us too.
Right.
Those patients that come in and they hear about us and that's how a business really grows the proper way.
Yep. Now, can I ask you, as far as like new patients or incoming patients?
Yeah.
Is there? How do you guys work around the whole insurance thing? I know a lot of it.
It's different.
It's different, right?
My office is definitely different. And this goes back. What happened to that United Healthcare CEO, right?
Yeah.
You know how that company in particular, unique situation. They were the worst of the worst when it comes to denial of care.
Okay.
So 32% of claims that would come into United Healthcare would get denied off the bat, which is crazy.
Yeah.
I mean, can you imagine a third of the patients that need, appendix removed? I mean,
Right,
come
right.
on. I mean, these are things that are life and death, right?
Yep.
And I'm baffled that it's even legal, right? But this guy, not to speak ill of the dead, but
Right.
I'm gonna for a second.
Yeah.
This guy actually enforced a new AI policy to just start denying claims. Can you imagine?
Really?
So instead of putting this onus on other physicians or other, insurance people to just deny, he would just let a computer start doing it now, which is crazy. I have a friend, so I taught at Midwestern for 4 years as well.
Okay.
Midwestern has a dental school not far from our office in Downers Grove.
Okay.
So, in Illinois, there's currently 3 dental schools. We used to have 4 at one time. We used to have Northwestern and Loyola. They both unfortunately closed down their dental schools. But we have Midwestern, UIC, and SIU down in southern Illinois.
With Carbondale?
In Carbondale, yeah. So we've got 3 dental schools in Illinois. Midwestern is the newest.
Okay.
And when Midwestern opened, the dean was actually my dean at UConn's brother. Monty McNeil was my dean at UConn. His brother, Lex, was the first dean at Midwestern.
Yeah.
So Monty gives me a call. He's like, hey, Omar, my brother's opening up a dental school down the street from you. I was like, really? That's awesome. He's like, yeah, I read your book. I want you to go teach there. And I was like,
Yeah.
well, Monty, I have a practice, right? He's like, just go part-time, man.
Yeah.
I was like, all right. So I interviewed there, and I got a gig there. And I started working there 1 day a week. And it was a lot of fun. I loved it. Loved it. One of the guys that was working with me there used to work, and he unfortunately got injured, couldn't practice dentistry anymore. So he got a job working for one of the big dental insurance companies. I'm not going to say the name. But he started working for them in Illinois, and he hated it. 1 day a week, the boss would come in and say, deny everything.
Just
Teeth that needed work,
just deny it.
just deny it. Teeth that needed extractions, teeth that were infected, teeth that could cause issues like they did with Mike Williams.
Right.
They denied them.
Serious.
Ridiculous.
Yeah.
Okay, so dental insurance companies have their own business mantra, right? They've got their own business. I got my own business. Okay, so I work with dental insurances,
Well said.
right?
Yeah.
But I do not work for them. Okay, so I work for my patients.
Right.
So I have a relationship with my patients, and I have a fee for my services, and my patients pay for it.
Yeah.
Now, the insurance will reimburse the patient for whatever they want to reimburse them for. But dental insurances are weird, too. They haven't changed their maximum allowable since the 70s.
Oh God.
Okay.
I mean, insurance itself is like a whole different topic, right? Like,
Ugh.
I don't know. I mean, I don't know how much you can elaborate more on that.
I can tell you about dental insurance.
Yeah,
I can
yeah,
tell
yeah.
you. Okay, so dental insurance. Okay, so back in 1974, their maximum allowable per year was $1,500.
Wow.
Today, a lot of dental insurance maximum allowables is now even $1,000 a year.
They went down.
They went down, which is
Wow.
ridiculous, right?
Yes.
So back in the 70s, $1,500 did a lot. It would cover a lot of services
Okay.
for a patient. Today, it'll cover like a crown and a cleaning or two. It's insane that it's gotten to the point where it has, but that's why I'm not in network with any dental insurance.
Right. Yeah, that makes sense.
Yeah.
Yeah, that makes a lot of sense. I mean, the whole concept of insurance, and I mean, there's so much loose ends, I guess you could say, behind that.
Yeah.
But I did want to bring that up just because I know we're gonna have some people that are gonna be watching and listening, and you know, I don't want them also to, you know, like be afraid to go and visit, or not afraid if they don't have the dental insurance, they can still come in there with you and
Absolutely.
you know, and
Absolutely.
even get a better, I mean, sense of what you're really spending, and then I know you have like programs to do, like you know, payment programs,
Yeah,
and payment plans.
Absolutely. We work with a couple
So-
different companies that help with that, help break
Right.
up the payments. Yeah, absolutely.
Perfect.
Absolutely.
So you're located out in Oakbrook.
Yeah,
Oakbrook
Oakbrook
Terrace.
Terrace. Yeah, Oakbrook Terrace. Yeah, but we call ourselves Oakbrook Smiles.
Yeah. 22 years.
Yeah.
And then I also kind of wanted to quickly touch on your new project as far as being the political game.
Sure.
I know you're out there in Lombard
Yeah.
trying to do a little bit of the trustee. Is that what it is?
Yeah, Lombard Board of Trustees.
Board of
yeah, so I'm
Trustees.
running for office. You know,
Yeah.
we'll see.
How does that work? When does that happen? Or when do you vote, or how do you go
So
about that?
this one, so we recently had a very big election, right? That one, most people show up to the presidential elections,
course.
right? And so there's a president, there's, you know, oftentimes senators or House of Representatives, people that are, you know, national level
Right.
stuff, right? And then there's also some county stuff and whatnot. At this election, this one happens on April 1st of 2025.
Okay.
It's a strange time of the year, right? Normally we think of November
Yeah,
as
for-
being election time, right?
Yep.
But this one's called a consolidated election. So it happens on April 1st, and it happens all over. But it's usually for more local election kind of positions, like
Right.
board of trustees, library board, oftentimes, you know, park districts and whatnot. So elections, and oftentimes they have like different little agendas items too, like, hey, should we spend money on, you know, building this new police station or things of that nature? They'll vote on things like that too.
Right.
So that one, I'm running for Board of Trustees in Lombard. It's called District 6. It's an area that is pretty much right in the middle of Lombard. It's right near Roosevelt Road and south of Madison, and basically between Westmore Myers and Main Street in Lombard. But it does go out to 83 a bit.
Okay.
But that little geographic area has about 5,000 people in it, 5,000 voters, excuse
Right.
me, in it, and more when it comes to, you know, kids and,
Yeah.
you know, non-naturalized citizens,
Right.
people in the area. You know, it's a large population of, you know, it's a mix of Americans there. You know, there's a lot of Caucasian, Indian, Pakistani, Latino, African American, Asian folks in that area.
Right.
So Arabs as well. And that area right there, you know, it's been represented. You know, if you look at our board of trustees, it's very homogenous. It's very, you know, vitamin D.
Yeah. Yeah.
And that's it.
Yeah.
And but Lombard isn't. Lombard's about 50-50 almost now
Is
when it
it?
comes to, minorities and non. And I
So we
feel
need
like we need
to-
some representation, you know?
For sure. We need a different perspective. Or
Yeah,
just other perspectives.
Other
I think.
perspectives.
Yeah.
And I think that's important. You know, one of the cool things I was able to do over the last couple of years in Lombard, I did the Citizens Police Academy just before COVID. And more recently, I did the Citizens Public Works Academy and the Citizens Fire Academy. So I learned a lot of what happens, you know, sort of behind the scenes. And it was really cool to learn. It was fun, especially I'll tell you, the fire one was super cool because we got to put out fires, we got to break doors down and stuff.
Really?
It was a blast.
Yeah, yeah, yeah.
It was an absolute blast. And all the folks there, honestly, they're hardworking, good people. All these folks, and a lot of these folks, they put their lives on the line every day, and it's I have nothing but respect for them.
Of course.
I don't go to work every day with my wife wondering whether or not I'm going to come home, right?
Right,
And
right.
And these folks, they do. And it's tough. It's
They're
tough.
running to the problem, right?
They are. They're
We're
running
trying-
into the fire, right?
into the fire,
I mean,
yeah.
I have nothing but respect for these folks.
Yeah.
Yeah. But anyways,
Good luck with that, yeah.
thank you. I appreciate it. And the board of trustees, they help, vote on decisions for the village of Lombard, and
Yeah.
and so I want to try and have a voice in there with and be a representative
That's good.
for some others as well.
Being that technology is advancing at a pretty high rate nowadays,
Yeah.
is there, not that you're worried about it, but do you think about the importance or the maybe importance of having AI assist as far as do you think that's a good thing or do you think it's a negative thing?
That's a great question. I'll tell you, I think there's good and bad with everything, right?
Right.
Like, for example, when I'm writing an email that's like a professional email, right? There's a lot of time. I'm going into ChatGPT and I'm asking, like, I'll come up with like a ballpark idea and I'll put it in there. I'll be like, make this look better. And it'll type it out so much better than I could ever.
Right.
I was doing a presentation about a month and a half ago for a lot of physicians about that oral systemic connection, right? And so I was sort of having like a little bit of writer's stump as to how to start this presentation off. So I went in there and I said, give me a first paragraph of how to start a presentation of a dentist to a bunch of physicians. And it gave me such a beautiful first paragraph.
Really?
It was awesome. I was like, dude, this is great. I'm cheating.
It's so awesome. It's scary.
It's scary as heck.
Yeah.
It's scary as heck. And you know what's even scarier? Because I'm doing it under my Google name, it
Yeah.
knows me.
Yeah.
And it knows that I'm, a brown Muslim guy. And it'll actually sort of infuse that into the way I speak even.
Oh.
Yeah, like in one of them, because it was a group of Muslim physicians I was speaking to.
Right.
It was called IMANA, which is the Islamic Medical Association in North America.
Okay.
They do a lot of mission trips to like when Haiti had some major issues and Puerto Rico had issues, they go out there and they do medical work in the
nice.
field.
Okay.
And so I had the pleasure of going with them once to one mission, and they do some amazing work. I just did dentistry, but they're going out and they're going to Sudan and doing cleft lip and cleft palate surgery.
Oh, okay.
They're going to like Haiti to do just straight up medical relief work, right? For these people, just to prevent major illnesses from spreading, and to help the folks that are basically they don't have access, right? So they go out there, and some of them they go like every week. They're there all the time. Like they have a year-round clinic that they just keep sending different people to. So I was speaking to this group, and so they threw in like an inshallah in the middle of it, which is the same in Spanish as ojalá,
Okay.
right? So like inshallah means God willing.
Oh.
So like, and what
Dios
does
quiere kind of thing.
ojalá mean in Espanol?
Ojalá means like, ojalá is like I wish in a sense.
Ojalá, I wish.
Yeah.
So I'm also part of this group. I work with these folks at Ojalá. There's a group in Chicago.
Oh, okay.
Yeah, you ever heard of them or no?
No, I don't think I have.
They're good people. So it's an
Ojalá.
organization. If you want to look it up for a second,
Ojalá.
Ojalá. Yeah, it's on. They got an Instagram. They got
It's OJALA.
OJALA. Yeah, it's Latino.
It's like I wish, right?
I hope. Yeah,
Yeah.
I hope. And for us, it's sort of like that. When we say inshallah, it's like I hope. Like I'm going to get an A on this exam.
God
inshallah.
willing.
Yeah, God willing.
It's kind of
I
like
hope,
si Dios quiere. It's
Yeah.
kind of God
So
willing.
that's it. It's
you go.
ojalá right there. Yeah. So okay. So these guys, they do some great work. They so every week they do this thing called neighborly deeds, and that's what we always end up at the end.
Oh, there
of
you
it.
go.
Yeah.
Okay.
So neighborly deeds, they go out, and it's been going on since 2018. And these folks, they go out and they just give out food to people that are like living in tents. like
Okay.
homeless.
Homeless,
Yeah, the homeless folks there. So it was started by Sister Alma Campos, Chris Pavlicek, and we all call him AK Abdul Karim, Raul Gonzalez, and Vilma Lopez. And those folks, it's amazing.
They're heroes.
They're absolutely.
Yeah.
They do and they recruit a lot of people, and they come every week, every Friday.
It's a weekly thing.
Weekly, every Friday night, they go out and they give a hot dinner. And then they also, every time they go out, and they know the folks that are out there, right? When they go out there, they talk to these folks. Hey, what do you need? Oh, some of them need some socks. Some of them need some, another sleeping bag because their sleeping bag got stolen. So they'll get it for them.
Yeah. They're looking out for the actual necessity.
They are.
Yeah.
And they're just doing it purely
Out of love.
Out of love.
Yeah.
Purely. And they're just gems. Gems. And I've had the opportunity to go out with them a few times. Just spectacular people.
Yeah.
Spectacular people, honestly.
And they're located where, you said?
So they go out in like Pilsen.
Okay.
And right nearby there as well. They go out to like 6 or 7 spots that they know where there's a lot of tents that sort of hang out, like under bridges and like these tent cities basically that are set up. And like there's one that's actually by a school. They go right under there. It's amazing. It's amazing the work they do. I got nothing
shout
but
out
love
to
for
them. Yeah.
Yeah, total.
Shout out to them.
Love them.
It takes special people to do those kind of generosities.
They go, if it's sub-zero, they go out,
They're out there. Well,
every week, every Friday since 2018, for the last 6+ years.
Wow.
Every week.
No catch.
No catch.
No catch.
No catch.
That's the beautiful part about it.
Yeah, it is. Great people. Great people.
Nice.
Yeah.
You know what? I also wanted to, like I told you earlier, we're gonna kind of touch a couple things here. But I'm always fascinated when Ilana comes to me and says, "Oh, the doctor, he went. I remember that you went to Turkey. I asked you about Göbekli Tepe. I love all the history and the origin
awesome
behind it. I don't know what's going on over there. I don't know why they don't keep digging, man.
Oh, it's crazy.
It's only I heard it's only like 15% of it is dug out.
That's it.
And they put a hold on it for the next 25 years now.
There's powers that be that don't
right.
want certain areas to flourish.
And is that just I read into it a little bit. Is that from what you see as well? Like, is it just like tourism attraction and they want to do they want to keep it a mystery just to keep attracting the tourism?
I think some of it is that. Some of it is they don't want to destroy what's available.
Okay.
But they also, it's crazy that there's just so much history there.
Yeah.
Like you're right in the breadbasket of where human civilization started, right?
Yeah.
Right there. When you go down to like the Tigris and Euphrates rivers, right?
Yes.
So like that area of the world where Abraham was, where Jesus was, right? Where Moses was, that's where Adam and Eve, they weren't far from there when they came down to earth. I mean, there's so much world history and like religious history there as well between the Jewish people, the Christian people, the Muslims. It's all right there. That's the breadbasket.
That's where it's at.
All of it. Yeah. And sometimes it's because of preservation that they don't keep going, and sometimes it's because of political influences.
Yeah. And I imagine might have something to do with just the fact that it's gonna maybe, how can I say this, mess up the timeline for a lot of people. Do you think it has to do with maybe some, religious, not facts, but just religious ways of avoiding certain details that might be discovered, I guess you could say?
I think that plays a big role in it.
Okay.
Absolutely. There's powers that be that definitely do not want certain things
To be
revealed.
Yeah.
Yes.
But you love it.
I love it.
I mean, I know you were there.
I love the history.
Years ago, I quickly, when I bump into you, I asked you about, you also did, I read about it through I call him my life teacher, even though I've never met him, but he's an author. His name is, I actually named Gael, his middle name is Paulo Coelho. He's a Brazilian author. He's my life guide. Okay. And he wrote on the pilgrimage that you also were part of.
We did. Yeah, we went in 2018.
Yeah.
And that was amazing. It was life-changing for us. Yeah, for sure. So that pilgrimage, it goes to a place called Mecca, which is in Saudi Arabia. And we believe it's the first house of God that was constructed by Abraham and Ismail,
Okay.
or people call it Ishmael.
Ishmael.
Ishmael in the Bible, right?
Mm-hmm.
So Abraham, he's the father of many religions, right? They call it Abrahamic faiths, right?
Okay.
So Abraham, he was instructed by God to build the Kaaba. Now, the Kaaba has been rebuilt a number of times over the years, but it's the same area, it's the exact same spot. And that is where we, as Muslims, have to go once in our lifetimes at one point. And it happens in a certain month of the year. So the Arabic calendar is different than the English calendar or the American calendar or the Anglican calendar.
Yeah,
So this calendar is based on the solar system in America, right? Or in the Western world, right? The Islamic calendar is based on the moon. So it's a lunar calendar. So it's actually about 11 days shorter. So it's not 365 days. It's about 354 days a year. So it's sort of weird because when Ramadan happens, that's a month of fasting.
Correct.
And when Hajj happens, it's a little different in the American calendar every year.
Okay.
Okay. So the Islamic calendar has 12 months as well, but they're lunar months.
Sorry to cut you off.
No
so
problem,
when you said
please.
so on the American calendar, the date always kind of varies.
Yes.
But it doesn't in the motherland.
It doesn't vary on the Islamic calendar.
On the Islamic calendar,
So
correct.
like when Hajj happens, it's in Dhul Hijjah, which is the month of Hajj.
Right.
So when we go to Hajj, Hajj is the pilgrimage. And like Malcolm X, he switched from nation to traditional Islam when he went for the Hajj.
Okay.
Yeah. So the Hajj is something that all Muslims at one point in their lifetimes, if they can afford it, need to be able to do.
Okay.
So thankfully we had the opportunity to go. 2018, we go there. And that's where we all, whether you're rich, you're poor, you're white, brown, black, yellow, whatever color you are, you're wearing the same garments.
Okay.
You wear, the men, we wear 2 pieces of cloth. Women can wear what they want to a degree, but as long as they're covered, right? And we do this thing called tawaf, and that's circumambulation. We go around the Kaaba
this.
7 times.
I didn't want to.
If you want to pull up a picture, if
Yeah,
you just
there's
type
videos
in,
too, right?
Yeah, there's tons of
I didn't
videos.
want to sound ignorant, but this is where
If you type in
where people-
Hajj, H-A-J-J.
people are walking around it.
Yes,
It's
yes.
like a black square.
It's a
I don't
black,
wanna- I don't wanna-
black cube almost.
Yeah, I don't wanna
exactly.
be,
No, it's all good.
Yeah.
It's all good. No, this is great question. So yeah,
There it is, yeah.
there you go. So that is the Kaaba right there. The Kaaba is the middle part. Now everything around it is something that's changed a lot over the years, and it's expanded dramatically over the years. So that right there, if you see that picture that you were just over a couple moments ago, so that is the main mosque now. That and the actual tawaf, that circumambulation happens around that Kaaba. So that Kaaba, and everyone in the world, every Muslim in the world, when we pray in that direction.
in that direction.
Always. So if I'm in America, the shortest distance from there, if you look at the airline paths
Right.
to get there, it's actually northeast, even though you'd think it's southeast. But regardless,
Yeah, the shortest way to get there through
Yeah.
airline or whatever.
exactly
Northeast.
And if you're in China, you'd be praying west or sort of northwest almost.
Yeah, northwest.
Or if you're in Australia, definitely northwest,
Correct.
right? So every one of us, when we're praying in the direction of the Kaaba. And we have apps for that now. It's a lot easier to figure
And
out
then where-
what direction.
so what is that made of?
So it's stone.
Okay, it's stone.
It's
Okay.
stone. But there is one very particular stone in it that's very, very important. If you type in black stone, in there, black stone, Hajj black stone. There you go. Yeah, black stone. There you go. There's a stone on one corner, and it's referred to as Hajar Aswad. That stone is actually considered to have come down from God. And this was brought down back in the time, and it's inside of that metal sort of obelisk, and there's only a few pieces of it left now.
Okay.
Over the years, and now it's just like a bunch of resin that's holding the rest of it. But that stone is straight from
You get to touch
heaven.
that?
You can, but it's a fight to get to it.
So that's where I was going because
Yeah.
the videos I've seen people trying to get in there, and I wasn't aware of what it was that they were. So it's this.
It's a stone.
Okay.
Yeah, that we're trying to either touch or kiss if
Yeah,
we can.
yeah, yeah.
It's hard as heck. I've gone twice now to Mecca, And I've been able to once touch it, and I was able to once go in and kiss it, but it was hard as heck. We had to go in like linebackers and make our way through. But it's a special stone. And the only reason we do it is because our Prophet Muhammad, may peace be upon him, did it. We don't do it because we believe that it holds any special powers or anything. But I will tell you,
happens to you.
I will tell you, when I touched it the first time, I was wired for like 72 hours straight. I couldn't sleep.
Wow.
It was crazy, and I've never done that before. So I don't know. I can't say say further, but it's not supposed to, theoretically, you know.
Right.
But it is an important area. And you see these two men standing next to it.
Yep.
They're like just sort of making sure there's like this large black cloth that goes over the Kaaba. And it's called the kiswa. But that cloth, they have to like orient it properly. But normally, when it's actually happening, when like there's times where they have maintenance and whatnot that there aren't many people allowed. So they put like barriers up where you can't get close to it, and then they work on it.
Right.
But normally it's a free for all there. It's like chaos.
It's open. It's just every day.
365, 7 days a week.
Chaos every day.
At that spot. In that corner.
that spot.
Yeah, at that spot. There are times and places where you can get
sneak
easier
in,
access. Easier access. But it's a lot of time, like during COVID, it was completely blocked off. Like if you see that picture down there on the right, right there. Yeah, you were over to the Arkansas Democrat Gazette picture, down left one. You'll see like down one and over one. That picture right there. So that picture, you can see like there's barriers around it where people can't get right up to the Kaaba.
I can see that. Yeah.
So normally people are right up against it, but here they have some sort of barrier up, and there's a time and place where they do put barriers up where you can't get in. The Saudi police, man, I'm telling you, there's Saudi police, and then there's Saudi religious police, and it's
Saudi
sort of weird.
police and Saudi
religious police. So the religious police are the ones that are inside this area, and they're tough. They're tough as nails. They do not mess around, and if you do things that they don't like, you're gonna get in trouble.
I bet.
Yeah.
Yeah, bad trouble too.
Justice is very swift there too. You don't want to mess with them.
It's a different type of justice system.
You don't want to mess with them. Yeah, that's all there is to it. Yeah, and so you don't.
That's interesting. I mean, that's where I think that culture's awesome. I just think it's a different perspective first and foremost, and it's a respected perspective at the end. And I think there's a lot of misconception.
Absolutely.
Right. I mean, I just think that it's automatically, unfortunately, engraved in our American minds that when we see something like this, it's something. It's very. They fear mongering us, throughout our lives about it. Yeah. And then when we see it up close, we're a little, starstruck almost to a point, or afraid, I guess you could say, right?
A lot of times. Of the unknown.
Of the unknown.
So
of the ignorance that we have, to be honest.
Like the reality is, since 9/11, the Muslim world has been the boogeyman, right? Mm-hmm. Before that, back in the 80s, when I was growing up in America, communism was the bad guy, right?
Yeah.
So after that, now they have to have another bad guy, right? Or else the military complex can't work, right?
The U.S. does something brilliant. I mean, I don't want to say brilliant, but, they pick their enemies in a way to stay rich, I guess.
Well, and also to keep the complexes going, right?
Yeah, the military
complex. So you got to have a bad guy, right? You have to have weapons of mass destruction. In Iraq, right? There were none.
Oh, my God,
there were none. And how many millions of people suffered from that, right? But here's the reality. Islam, the religion, actually, the word Islam means peace.
Okay,
so salam, you've heard the word shalom, right? Salam, you've heard some people sometimes say assalamu alaikum, right?
Right.
Assalamu alaikum means may peace be upon you.
Okay.
That's our greeting. Right? And a lot of Catholics, they say it in church. They say, peace be upon you.
Correct.
Peace be upon you.
Yeah.
That's the exact same thing as assalamu alaikum. And wa alaikum assalam. And may peace be upon you.
Okay.
So when we say salams to someone, we're literally making a prayer for them. May peace be upon you. May happiness be upon you. When Islam was spread, right? The part of the Middle East that Islam came, it started in Mecca, right? When Islam came, at that time, Mecca was being used, unfortunately, for idols, idol worshiping.
Okay.
So this was the house of God from Abrahamic times, and slowly, it devolved and became a house of worship for idols. And people would still come and, pay their respects. It was a tourist attraction for forever. Back when it actually started, before it was even the Kaaba, there's an area just a couple hundred yards away from there.
Yeah.
Where there's two hills called Safa and Marwa. And Hagar, we call her Hajra in Arabic. Hagar was left there with her son Ismail when he was a baby by Abraham. He was told by God to leave her there. She had nothing. She was in the barren desert. And so she's looking for help. She's going to Safa and she's going to Marwa. And we reenact that when we do this as well. We do this 7 times, and then we go between Safa and Marwa 7 times. It's a long walk. It gets exhausting. It's hard on the feet. But we go between, we literally reenact what Hajra or Hagar did. And after the 7th time, she was like, basically came to her knees and said, God, help me. And Angel Gabriel came down and struck his wing to the ground, and out sprung water. And she needed it to feed her baby. And with that water, when the water started coming out, she started saying, Zum, Zum. That means stop, stop, because she didn't want to lose it. And so we call it the Well of Zamzam today. Yeah. And so that
so it's there?
It's there today.
Where the angel Gabriel came down and struck there.
Yes.
Oh, man, I got to see that too, compa.
And so that water, right? So that water, if you look at the Well of Zamzam, yeah. And if you just go to images, there aren't that many.
I love those stories. I love those kind of stories.
And so when I came back from Hajj, I brought back Zamzam for all the girls in the office. Okay. And Ileana took some, and she's like, Dr. Haque, can I have some for my mom too? Her mom wanted some too.
So I want to thank you. You did bring along some gifts.
Yeah.
And I'm a huge book reader.
I heard.
Yeah. And well, we'll start off with yours actually.
Sure.
Wasn't even aware that you well, you know what? I'm not gonna lie. Ileana told me, but I didn't know that you were gonna bring it.
Sure.
But she did tell me, hey, she already told me, I think yesterday.
Yeah.
He wrote a book. I'm like, what?
Yeah.
So I do want to thank you for the book.
My pleasure.
Dental 101.
Dental 101.
Yep. I can't wait to see what this is all about. Sure. But also, as important, you brought me copies of the Quran.
Yeah, in English and in
English
Espanol.
and in Spanish.
Yeah.
So I am very interested in this just because I am very curious with origins, and I'm very curious with religious origins as well.
That's cool.
And I'm very curious more than anything. So I will enjoy this. This is all part of what we're learning, sort of. I mean, this is what I'm going to read in here.
Now, you're not going to see as much about actual Zamzam in here.
Right.
You will actually see the story of when Abraham, of Hajra going between the hills. You will see the stories of Moses in there, the stories of what happened with the Pharaoh. In fact, the longest chapter in the Quran is called Al-Baqarah, which means the cow. And the cow discusses the entire story of Moses, from birth into the river, where the Pharaoh's wife finds him, adopts him essentially, raises him as her own.
Yeah.
And then he finds his roots, and he eventually becomes a prophet, right? And he goes back and eventually becomes the leader of the Jewish people. And we believe in the original Torah. We believe in the original commandments.
Okay.
And but we also do believe in what happened with the cow. And the cow is the name of the chapter, right? The cow is what happened when he left for, when he went to Mount Sinai. And when he came back, and he's like, what's up with this gold cow, man?
Yeah.
And, we do believe, and we believe in the original Bible. We believe in Jesus as the son of the Virgin Mary. We believe in there's a whole chapter on Mary.
Okay, you had mentioned there's a whole thing on the Virgin
Mary.
Virgin Mary.
And it discusses Jesus in length as well.
Okay.
And his miracles, how he cured the blind and cured leprosy and would be able to walk on water. But we don't believe in him as the Son of God.
Right.
We actually believe in him as a prophet of God.
Okay.
And we believe that all the prophets had miracles of their own. And we believe that all the prophets, so we have messengers and prophets. Messengers are the ones that were trying to put out the message, and prophets are the ones that actually brought revelation down and brought revelation to the people.
And were there is there a lot of prophets that
like tens of thousands of prophets. But in the Quran, discusses a number of them, like Adam, Noah, Lot. Lot is a big story in the Quran.
Okay.
You know, Lot and the people, you know, the Sodomites,
Okay.
and what happened to them after, you know, and they didn't listen, and he left. And when he was leaving, he told everyone, "Do not turn and look behind." And his wife, unfortunately, did, and she was destroyed too.
Oh.
Yeah.
Okay.
So, and like you see stories like Noah, when he was in the boat,
Right.
and his son was like, "I'm fine," and he's like swimming, and he's like, "Please, just
Yeah.
accept."
Yep.
And the son's like, "No, I'm good. I'm gonna find a hill," and he perished too. You know, so it's like, you know, belief. We do believe in belief.
Belief is important.
Yes.
Belief is very important.
It is.
I think that you know, obviously religious talk is can get touchy, of course.
Can, of course.
But I think just having something in your belief system and believing in
Something.
your God, whatever, you know, but you have to believe in something.
I think so.
Yeah.
I think it has a big impact. I think, you know, what is the first thing anyone ever says, like when they're about to get into a car accident? You know? Oh my God. Oh my God.
Yeah.
Right? Even
Yeah.
if they're atheists, right?
Or- yeah, of
Maybe,
course.
Yeah, right?
Yeah.
Or, you know, in those life and death moments, the first thing we think about is, oh God, please help me.
Yeah.
You know?
Yep.
Right? It's just inherent. And there's a reason that it's inherent. Right?
That is kind of interesting, right? How is it embedded into your consciousness to automatically think that?
Because it's real.
Right.
Right? It's there.
Yeah.
It's there. Could any of this happen? Okay, so let's, you know, technology. It's moved at insane lightning speed, right? But can we create even a cell on our own without any ingredients that are available to us from what we believe God created?
From what we're made of, you mean?
Right? Yeah. Can we make? We can make androids. We can make robots. You know.
Yeah.
We make C-3PO. Look
We're
real,
getting Tesla robots soon.
Absolutely,
Yeah.
right? Tesla robots. It's super cool. It's super cool. I love this stuff.
Right.
But we can't make a human, right? We got ChatGPT telling people to kill themselves, right? Or it was Google Gemini. Sorry,
Google Gemini.
Google
correct.
Gemini told someone to kill himself.
Yep.
I can't believe it. That's crazy.
Yeah.
It's starting to get down that, you know, that
Well, that's where I think AI is
Terminator 2
Yeah,
world.
it's gonna get
It's
kind of crazy.
It is.
Yeah,
It is.
Ex Machina and everything. Yep.
Facebook, they were making an AI language that they ended up having to destroy because it was starting to take away the other software on its own.
That, and I think it created its own language where we weren't able to like
Stop it.
decipher. Yeah,
They had to
decipher
like
language.
shut it down.
Yeah, before it gets crazy.
It was crazy.
Yeah.
It's nuts, but it's almost creating its own consciousness. I don't know.
Yeah.
That's a different story. Right?
I like this segue because earlier I had mentioned to you I just finished reading this book. It's called American Cosmic.
Okay.
By Dr. Diana Pozalka.
Okay.
And she's got her doctorate from North Carolina and Berkeley, California.
Nice.
She's a theologist major, right? So she's all religious studies, and I love the way she just kind of it's a parallel kind of thing with fallen angels and aliens, like the fallen angels from the past to the aliens of now, and what we consider now. We say it's an alien, and back in the day, you know, she already went into like the Vatican archives and read the descriptions of what they thought were fallen angels, and that's what they called them. And because, you know, society was just more religious as well back then.
Absolutely.
So now it's just like, oh, now it's an alien, and now everything's like, okay, so where are we with this? And I had brought it up to you earlier.
Right.
You're like, hey, I have a little stand. You know, you
I
have
love
your
it.
point of view on it.
I guess mine is pretty much similar to what the Vatican's
Oh,
belief
nice.
is to a
Okay.
degree. You know, because the concept of fallen angel for my part of the world, for the Muslim world, jinn. It's
Jinn,
another
yeah.
being, right? So jinn, like genie. You
It's
remember
like the bad guy,
Aladdin?
isn't it?
Not necessarily.
No? Okay.
They're a good. So
They're good jinns
we
and bad
sh-
jinns?
Yeah. So we
Yeah,
believe.
yeah, yeah.
So like the way humans have the ability to make decisions, right?
Uh-huh.
We have the ability to choose right and wrong, or be good or be, you know,
Be bad, yeah.
be bad,
Yeah,
whatever.
bad
we
decisions,
have,
correct.
we can, or make mistakes,
Right.
right? Things like that. Things happen, right? We believe that jinn have that same consciousness. They have the ability to choose right from wrong, but we believe we can't see them with our visual spectrum,
Okay.
and they exist. But they usually like to do things on their own, except for some of the bad guys. Some of the bad guys are the ones that come in and mess with us, like the poltergeists, or the ones that are ghosts, or perhaps aliens.
Okay.
You know, they're just messing with us. Some of them are just doing it for fun, and some of them are doing it to literally are doing it because they've been instructed to through black magic. So the concept of magic is a thing that a lot of people do believe in. You go down to New Orleans, you'll see all kinds of stuff about
That's
magic,
true.
right?
Yeah.
You go to a lot of different parts of the world, and they'll say,
Oh, yeah.
they have this thing to help prevent the evil eye, right?
Oh, yeah. That's
It's
huge in
big-
Mexico.
huge in Mexico, right?
Huge in Mexico.
You go to Morocco, you'll see this eye that
Yeah.
people hang on their doors to prevent the evil eye.
Same thing, huh? Yeah, same concept.
Same thing. Turkey, a lot of the Middle East, you'll see that. And in India, Pakistan, what they do is to help prevent the evil eye or to prevent black magic, they'll do sacrifice of a goat and give the meat out to the poor.
Oh,
There's just different techniques in different cultures
yeah.
that deal with, what the word in Urdu is called nazar. Nazar is like the evil eye. Like,
Okay.
they'll say, like, my mom will tell me sometimes, she'll be like, hey, don't say so much nice stuff about your kids, or don't say, nazar, you'll get nazar. You'll get the evil eye on you from
Yeah, yeah,
someone,
yeah.
So that's why we just, my mom filters what she says to people sometimes,
Right.
so that she doesn't get nazar.
Yeah, that makes sense.
I'm like, all right, whatever, that's cool.
It's kind of like runs hand in hand with like envy.
Envy,
Right.
exactly, jealousy.
Yeah,
right?
jealousy.
Right?
You don't want to show off that much good things because
No,
then
you
they're going
don't.
to wish bad upon you.
Exactly. You don't
Yeah.
want to do that. You want to be good. I mean, so there's a concept of envy, but there's also the concept of humility too, right? Like, humility is important, I think, in so many different factors in life, right? So, like, when someone is, you don't need to beat anyone down. Everyone's got their own thing going on, right? We're all human. We're all going to end up in the same place one day,
I agree.
right? And I can't take anything with me
Right.
at that point, right?
Mhm.
And so that concept, that's huge. You were asking about afterlife earlier, right?
I did ask you about afterlife.
Afterlife, man, I'll tell you, that's something that's the reason I believe in many ways, right? Is because, listen, there's got to be something after this, Is it just all over?
Do you feel like it's a lost topic of conversation, the
do.
afterlife?
I do.
Because I know ancient Egypt was obsessed with it.
Huge. I mean,
Yeah.
you saw the pyramids, right?
Yeah.
Literally huge.
I mean, the pyramids, I really don't know exactly what's going on with that.
That's
myself.
crazy.
Now,
That's crazy.
the more I dig into it, I'm like, well, there's no coffins in here. There's no bodies in there. This is not what they're telling us it was.
It's not.
But I mean, just with the fact of afterlife in ancient Egypt and how important it was to them and how they were trying to figure it out or something, now I see it and I'm like, well, no one's really paying attention to this anymore.
No.
Or no one's really talking about it.
It's quiet. It's
Yeah,
quiet.
it's
'Cause
very
we-
quiet. Well,
you
no
know-
one knows about it, of course, right?
Maybe.
No one's going to come back and tell us.
We got no answers.
Yeah,
except through religion, right?
Okay.
That's the only way. Through either like different religions have different ideas about the afterlife, right?
Yeah.
And some of them don't really talk about it at all,
Okay.
right? So, like, obviously, in the Christian faith, of course, they talk about heaven and hell, right?
Right.
In Hinduism, they talk about reincarnation, right?
Right.
Into a different being, so to speak. In Islam, they talk about heaven and hell also, but we also talk about the Day of Judgment a lot.
So there is a heaven and hell
That's what
in the Islam?
Yeah, in Islam. very
Was
much
there
so.
purgatory?
Yes.
There was.
Yes.
There is?
There's purgatory for those that decision hasn't been finalized yet, sort of, kind of.
Does who? I mean, I'm just asking to ask, you know,
Yeah.
because purgatory just got. It doesn't exist in the Catholic world anymore.
It doesn't, huh?
No, up to
It
recently.
used to, though, didn't it?
It used to.
Wild.
Yeah.
See,
yeah. That's crazy to me
so
too.
let's go into that for a second.
Can
yeah?
we look up when purgatory stopped existing? I think it was about 10 years ago. I think.
No kidding.
Yeah, it was not that long ago.
That's wild.
Yeah.
That's really recent. So interesting that you bring, because the concept of change, right?
Okay.
Like evolution or adaptation, right? In religion, so Reformation, right? So there's a lot of
Reformation,
people
yeah.
out there, especially in like the Western world, that want to see Reformation in Islam because they think we're all backward. Oh, the women are covering their hair.
Right.
Men are growing their beards. These folks, they're washing their hands 5 times a day and praying 5 times a day. What's up with that? They're
Yeah.
crazy, right? But Reformation is one of the things. That's one of the things that God promised is that the Quran will never be changed.
Right. I was
Right.
going to ask you that about this because this
So now, an English translation isn't the Quran, right? It's
a
It's an
translation.
interpretation.
Yeah,
Exactly,
correct.
it is an interpretation. So
Right.
there is room for some.
misinterpretation. I guess you could
Sometimes,
say.
yes,
Yeah.
yes. So that's why the version I gave you is considered a good one. Oh, didn't the Catholic Church do it? Okay,
Of course, he has.
Cyber Week, of course, adds.
I know they just. I know the Pope, a Pope, just not too long ago, said, "Hey, you know,
Concept
what?
was rejected by Protestants at one time. Yeah. Okay.
I forgot what Pope. They say like which Pope. I
Say
guess you could say
Pope stopped believing. Yeah, believing. Okay.
exists. What?
I don't know.
I don't know. I literally
don't
read
know.
that in the American Cosmic that it does not exist
Wow.
anymore. Yeah.
Wow. So it depends on the source
It's
sometimes,
still,
right?
it's still. I mean,
Yeah.
it's still
But-
part of the times of where they lived before and now. Because now, I mean, even if it says that it does, who's talking about being in? Or am I confusing it with limbo?
Maybe.
Yeah,
Maybe
right?
Limbo or like pre-grave or pre-judgment. I'm
Yeah.
not sure.
But
Yeah.
even still, I think it's that time. Like I just mentioned earlier, like back in those days when religion was top priority for
everyone.
everyone. There was
Yeah.
no social media to fall back
Right.
on.
Yeah.
There was no TikToks or whatnot.
Nothing.
Yeah,
Nothing.
just
That's
faith.
That's everyone had that, and they got their news at church, right? For the longest
Yep.
time, for many, many.
The
many
rock stars were
generations.
in the Catholics at least, and Christianity. The rock stars were the priests. They're also the guys that went to war.
They would.
Yeah,
That's wild. That's wild.
yeah.
And similarly in Islam, the imams would be the ones leading the charge as well for either for defense or for attack, depending. Yeah, when it came to war. So yeah, the religious leaders were the ones very involved in politics as well back in the day. Yeah.
Yeah. They kind of they were going to direct where things were going to go.
Yeah.
So, are you under the assumption that the fallen angels are what we now call aliens? Then,
It's in some ways, I think.
Yeah.
Yeah. Fallen angels being sort of like our version of jinn. Yeah.
oh yeah, jinn.
So in our faith, we believe in angels as well. We talked about Angel Gabriel earlier,
Right.
And we believe that there's many, many, many millions of angels, and two angels that are always hanging out with us. Each one of them writing down our good deeds, and one of them writing down our bad deeds.
Okay.
All the time, and those scrolls will be revealed on the Day of Judgment.
Day of Judgment.
Yeah, and so that's when we that's when God decides, where are we going to go, heaven or hell, basically. But that Day of Judgment is going to last. It's going to feel like 10,000 years, though. So it's not going to be a day. It's going to be a long time. Yes, it's going to be brutal.
And then,
It's
is there any? I've read some people that after death they see the soul go through like the Milky Way and all.
Yeah.
That. Is that something that you guys relate to?
So
or
like
not really?
that light at the end of the tunnel
Yeah.
kind of thing. What we believe in is like when someone passes away and once they're buried in the Islamic tradition,
Right.
it's always a burial.
It's always a burial.
Always a burial. And in fact, when we are buried, we're buried with our head facing the Kaaba.
Okay.
Yeah. And so we believe that after the dirt literally comes down on us, and we're buried in a very simple way, 3 pieces of cloth, and that's it.
That's it.
Go into the ground, dirt. In America, they have different rules and regulations, so sometimes we have to get like a cardboard box or a wooden box or something before we go in. But we believe that once the last visitor has left the funeral, and we get buried usually very quickly. So like if someone passes away, usually within 24 hours, we're in the ground.
Oh, really?
Yeah, it's
Okay.
a quick burial. It's quick burial. Because it's the rights of the person that passed away to be able to
Make his journey. in a
start
sense?
his journey.
Yeah. Start his journey.
into the next life, which is the life of the grave. So we believe in like a few different lives. So there's the life before we even started this life, when we were just basically a soul, just a soul, not even in a human form yet. So we're a soul at one point. Then we are born into human life. Then there's the life in the grave, and then there's the life of the day of judgment, and then there's the life in the hereafter. And the longest one is the hereafter, which is infinite. But the second longest one is that day of judgment. Super long, unless the soul was around for millions of years. We don't know exactly too much about the soul.
The soul's interesting.
It is. It's fascinating.
Yeah, it
that
is.
we were already a cognizant being at one time, is what we believe. And the soul is, we can make a body pump blood, have, full function of everything almost, but that body's no longer alive if the soul is gone, right? There's actually a number of studies that show that the weight just slightly changes.
Once you pass, correct?
Yes.
Yeah.
Yes. It's like,
I forgot what it
it's
is.
a couple ounces.
Some ounces.
Nothing
correct.
much, but those ounces are apparently what the soul might be. That's what some people postulate.
Yeah.
It's fascinating to see that.
It is fascinating. Soul and consciousness, man. I think it's right up there with the greatest mysteries of you say the good gin, bad gin. I do believe like when you get a good idea, who gave you that idea? Like how did it pop up into your head?
How many times has it happened where, like, let's say you're playing a sport or something, and baseball's coming from nowhere, and you moved out of the way. How did that happen?
Right.
You didn't even see it.
That's a good example too.
There's things that happen that you can't totally explain all the time. And that's oftentimes something from what we refer to as the ghaib, the unseen, the unseen world. There's things that happen that we don't know. Guardian angels, things that are out there that are happening, but you can't quantify it. You can't prove it in a scientific way.
Correct.
At least with our scientific method.
Yeah.
Right? And some of it is anecdotal, and some of it is perhaps miraculous, but we can't explain it. And that unexplained stuff is oftentimes, just, again, going back to belief, right? Just belief in a greater power.
Right.
Right?
Yep.
Yeah.
That beats the in a sense it beats the scientific method.
In many
is
ways.
your belief, yeah.
Is belief. And belief is so important. I'll tell you, when someone thinks and this happens a lot with cancer patients, if someone thinks they're going to die, they oftentimes will. It's almost like a self-fulfilling prophecy in a way, right? But if they believe they're going to get better, oftentimes they will. They just have to have that positive outlook, positive attitude. It doesn't always work that way, but a lot of times it does. And there's a lot of studies that have actually shown that is the power of willpower.
I think we undermine the power of our psychological self, like just how we can either psych ourselves up so much or psych ourselves down so much as well.
Yeah.
Yeah, that positive thinking beats negative thinking,
Absolutely. Doesn't help with the Bears, though.
I think. Oh, my God. No, it does not. No, are you a big Bears fan?
I am. I've become one.
Sorry to hear that.
20 years. It sucks. I picked wrong.
I love the Bears.
You know what's crazy?
Yeah.
So I grew up in Connecticut, right? I
Yeah.
grew up, guess what? A Patriots fan.
Of course, yeah.
Right,
Okay,
right?
that makes sense.
So back in about 2001 or so, Robert Kraft, owner of the Patriots,
Right, yeah,
he
yeah.
comes to Connecticut and he says, I'm building a stadium in Hartford. Because it was called the New England Patriots. Now,
Yeah.
New England is Connecticut, Rhode Island, Massachusetts, Vermont, New Hampshire, Maine, right?
Okay.
And he says, I'm moving the team to Hartford. I got amped. I was like, yes.
Yeah.
Down the street. I got my Patriots down the street. And he was just using it as leverage to get Gillette Stadium built, right?
Yeah.
And then I was salty as heck. And guess who just started
man.
at the same time? Tom Brady. Great job to
Yes.
stop being a fan of
I was
the
trying to
Patriots.
remember right now. You said UConn. All this
Yeah,
time,
UConn.
What is it, like an
Basketball.
hour now,
Right,
over an
yeah,
hour, and I'm
yeah.
like, wait, what were you guys are the Huskies?
UConn Huskies.
Were you there when it was like
Two-time national
Rip
champ-
Hamilton?
Rip Hamilton was
Yeah.
So I finished
Rebecca Lobo.
women's basketball. So I knew Rebecca Lobo. She was
Really?
she was really cool. She was
Nice.
way taller than me.
I bet.
Really-
Yeah.
And she was dating one of the football players at the time who
Okay.
happened to live in my dorm. So we saw her all the time.
Yeah.
And
Oh,
and
that's
she was nice. She was nice. She was a really good person too. Now she works at ESPN,
Yeah.
ESPN's just down the street from where I went to
ESPN's right
dental
there.
school. Yeah, it's in
Yeah,
Connecticut
yeah.
too. Yeah, so ESPN's there, UConn. What was amazing was when I was at UConn undergrad, we were okay. We were good, but we weren't great. Okay. When I got to dental school, that's when we really started getting to that next level. That's when Rip Hamilton, Khalid El-Amin had
He
that
was
first
awesome.
championship.
Yeah.
And ironically, that year, I was still, when I was in dental school, I got into dental school before I finished undergrad.
Okay.
But it was under the requirement that I finished undergrad before I finished dental school.
Okay.
So I still had like 7 or 8 classes to do. I had like almost a semester and a half worth of classes to do while I was in dental school. So I was taking like 1 class a semester, and I was just showing up for the exams. That's it.
Yeah.
And I was just passing. I was just trying to pass these classes, right? Because I just wanted the degree, or I had to get the degree.
Yeah.
So my final year of undergrad was actually not until my 3rd year of dental school.
Wow.
And I'm going there and I'm taking my last class, and it's music appreciation. And
Nice.
I like music, but I'm not good at anything in
Yeah.
music. Okay, I enjoy listening to it, but this music appreciation class was mostly like classical, old stuff. You know, like Mozart and Beethoven, and
Right.
Tchaikovsky, and all. And so we had to identify. Like, they would play the song, we'd have to identify the composer, the year, blah blah. We had like a chart,
Really?
and we had
Yeah.
it was, again, rote memorization.
Yeah, yeah.
But at this point, I had already learned how to memorize, right? I had already been to Pakistan now. I knew how to memorize well. And so I'm there, and Khalid El-Amin, he knows me because I used to go to all the games. I'd be like front or second row. So he knew me already. So he's
Really?
like, Omar, yo, man, you know this stuff? I'm like, yeah. So a couple of these guys, you know, I helped them out, I tutored them a little bit, you know, I just told them what to look for and stuff like that. And so I got some tickets out of it too. It was great.
And he came to the Bulls, didn't he?
Yeah, he did. He was on the Bulls for a while, and then
got
he
drafted
was-
by the
he
Bulls.
did. He did.
Yeah.
He was a great guy. He's a great guy. And Rip Hamilton had a phenomenal career with the Pistons,
Yeah.
and he even came to the Bulls for a little while too.
Oh, yeah,
Yeah, he did. It wasn't for too long.
It was
though.
in and out kind of
Yeah, it was in and out. Yeah, unfortunately. But who else? Like Jake Voskuhl was there too when I
Voskuhl,
was there.
yeah.
But then later, you know, UConn just had such great runs, man. I mean, they've 5-time national champions. I mean, it's just
I mean, the
last
women's
2 in a
team
row.
was crazy.
Women's team
Is
even.
that
Oh
Gino,
my God,
Gino
Gino
Ariema?
Ariema.
Yeah,
That
yeah,
guy
yeah.
is a monster. That guy, he has led so many UConn teams to championships. It's just, and he's recruits like I mean, almost every girl, almost every female basketball's dream.
Yeah,
To
to play
play
there.
UConn.
Play for him.
Play for UConn. Yeah.
Yeah.
Yeah. Play for him.
Yeah, college sports, I haven't been too updated with them. I know it's crazy because of the NIL.
Yeah.
I can only imagine
It's
how
changed.
tough it is now to
Changed
keep
the whole
these
game.
kids like.
They don't stay anymore.
Yeah. How do you keep these kids humbled if
can't.
they're freshmen that make millions already?
You can't keep them humble.
No.
You know, at that point they are king of the hill on
Yeah.
campus. You know, but they already were. Okay, back when I was in school, they didn't make any official money, but they were already king of the hill. Like, just socially, right?
Right.
They had it
They
all.
were making money too, man. Now you get all these stories on ESPN, and they're
Yeah.
like, "Oh yeah, Gilbert Arenas made all this money and this and that. They're signing balls and whatnot."
Yeah.
I mean, they made their way. They had to figure it out. I mean,
did. They
it's also kind of, the schools are making millions and millions and maybe
It's only
billions
fair.
off. Yeah, it's only fair.
It's only fair.
only
Honestly, those students were not going to college to get an education that way. They were using it as a stepping stone for their
It was almost,
future
they had to
careers.
do it.
Yeah,
Yeah,
absolutely.
Yeah.
Good for them.
yeah, good for
Good for
them.
them. Yeah, it was
Doctor,
fun.
where can everyone can find you on social medias? Correct?
Sure, yeah. So we have my dental practice is Oakbrook Smiles, right? So we have a TikTok now.
Oh yes,
Eliana's helped me a lot
You're
with that.
actually
Yeah.
very active.
I
On
guess so.
TikTok.
Yeah, I'm getting
Yeah.
there a little bit. So
You went
and
viral
then-
already, didn't you?
On a
Sort
couple
of
of them.
viral?
A
Yeah.
couple
Yeah.
of them, yeah. So if you look at our Oakbrook Smile, it's just called Oakbrook Smiles.
Perfect.
At Oakbrook Smiles, I think, yeah.
Uh-huh.
And we're also on Instagram
Oakbrook Smiles.
and on Facebook for some of the old
Perfect.
timers.
Yeah.
Yeah.
So the people can go
Originals.
and check you guys out.
Yeah, and my name, if you ever wanted to ask me something, you can ask right through there.
Yeah, send a DM. Do anything that you guys consult. They can give you guys a car. Send a message to
Absolutely.
the social medias.
Our website is oakbrooksmiles.com.
Perfect.
Yeah, and so we're, we love taking care of our patients and helping them, achieve their dental goals. And sometimes,
And then
You know-
what do you have in store for the future? You got any plans? I mean, what are we looking at? Do we have your son coming into the future, or
maybe.
what do you
I
any
think-
plans, man?
My son is more interested in medicine.
Here you go.
My daughter, though, she's planning on going to dental school.
Okay.
So let's see. We'll see.
Yeah.
Time will tell.
Time will tell.
But she's told me that she likes orthodontics a lot, which is braces.
Braces.
So she does go into it. Very
you're
cool.
just gonna have
whatever.
to adjust.
Accordingly.
Added to it.
Added services.
Yeah,
there you
added
go.
service.
And then we got another practice coming up right across the border in Indiana.
There you go.
Coming up, Hessville Smiles.
Congrats,
Yeah,
man.
Thank you. I appreciate it.
Where in Indiana is that going to
So
be?
that's going to be in Hammond, Indiana.
Hammond, Indiana.
Hammond, Indiana.
We do have
Right.
people that check us out from Hammond because
No kidding.
a lot of Mexican people that go to our events and whatnot.
That's awesome.
Yeah.
That's
so
awesome.
what's that one going to be called?
It's going to be called Hessville Smiles.
Hessville Smiles.
Hessville.
Ah, there you go, Hessville.
And Hessville, ironically, that area is also happens to be a very large Latino population.
Oh,
there.
yeah.
It's awesome. They're really, really wonderful people there.
Yeah.
Just really kind.
Yeah,
really-
hardworking people there.
Absolutely.
Hammond
Absolutely.
in that area, it's just hard work. They just go to work pretty
Good
much.
people, just good people. Honestly, just really, really nice people. I'm going to be honest with you. Every single Latino person I've ever interacted with is just good heart,
Yeah.
good human being, just strong work ethic, and it's something that honestly my people could learn a little bit from.
You know what? I mean, I just think that it's an immigrant maybe
think so.
mindset.
I think so.
People that really do want to strive for more. And more than anything, I think they're coming from a place that gives you less and offers you less.
Yeah.
We're a little bit catered here in the U.S.
Big time.
Granted, I love the U.S., right? I
Yeah.
mean, who doesn't?
Right.
But, I mean, we are kind of spoiled in that sense. And, things when we started off the conversation, you going back to the motherland, and it's a big piece of humble pie. I think it's very parallel to the Mexican community. I think
so.
a lot of us go back to Mexico to kind of I see a lot of people on social media, young people that are like, oh, I can't wait to be back at the ranch or the village per se, right? Where Wi-Fi sucks, where there's no clean water, everything's bottled
true.
water.
Same thing.
Where the food is not the greatest because we're used to all this processed food.
Right.
Where everything's just, but yet you feel like at home, right? And you feel like that humbling piece that you're missing because just, I don't know. I mean, America's great. Don't get me wrong.
I do.
But I do think that we got to go back to the origin, and just kind of feel it for a couple of days.
I'll tell you, there's one thing you say that, and it just brings home a really big message. And I see a similarity big time between the Latino world and the people of India, Pakistan, is the concept of family.
Yes.
It's huge in both of our cultures.
Yes.
It's huge. It's paramount. And honestly, and a lot of it revolves around just being together, but also food. Food was a way that my grandma always brought all of us together. Umar, come down. It's time for dinner.
Yeah.
My grandma was doing my home. No,
Yeah.
get down here now. Okay, fine. So I go down, and everyone's sitting together, and it's beautiful. It's a beautiful thing. I miss it. Having that huge family together, eating together all the time, every night. If we didn't, we got in trouble,
Right.
right? And so, why weren't you at dinner tonight?
Yeah.
Oh, I have a big test. I don't care. You're sitting with me. That's it.
Now that you brought that up, and before we, start kind of breaking it down, but do you feel, now that you brought that up, do you feel that gets lost, obviously, with time, now that we're here in America, as far as like the American way of thinking and doing things, and the kids growing up with, obviously, other friends that are not in our culture and just think, like, nah, Dad, like, that's not what we do here, kind of thing.
I think culture plays a role in it. The people that were around. I think distance also plays a physical role.
Distance, correct.
Right, because I don't know about your family in Mexico, but my family was in Pakistan. The families all were really relatively close to each other.
Okay.
And they grew up as big family units.
Yeah, you
Right.
grew up in the same building or the same house or the same one-room apartment or whatever.
And everyone's sort of together.
Yeah.
Love it or hate it. It was everyone's together.
It was bonding.
There's bonding, there's hate, there's love, there's
Yeah.
it all comes together, right?
Yeah.
But what's fascinating about it, though, is that those family ties that are there, those are like forever, right? I mean, like my dad had it more than I did. He grew up with a ton of cousins that were all together. And the stories he would tell me of his childhood, very different than mine. I grew up in America where, when I would see family only when I'd go on. Our vacations were always to go to either Pakistan or a family that were lived in other countries, like Dubai or England or
okay.
Canada.
Yeah.
And so that was our vacation. Our vacation was going to see family. It wasn't going to Disney
Sightseeing.
World, the sightseeing.
Yeah,
It
yeah.
wasn't going to national
Same.
parks or any of that.
Yep.
Although I started doing that now with my kids.
Right.
But, thankfully, my wife's family lives close by. My brother's in Arizona. My mom's in Connecticut. So we see them once in a while, but not
as often.
Not as often.
Yeah,
not
not
every
as
night.
often.
Not every night like we used to, like my dad used to in
Yeah,
Pakistan,
yeah.
Yeah,
I think that's a little bit of the, it's on all of us to kind of
is.
try our best. Yeah, to keep
try to keep the bond.
Yep.
Keep the ties of family.
That's
you know?
right.
Yeah, it's a lovely. It's something that definitely unites a lot of us.
Yeah.
And I think a lot of us, it happens at Thanksgiving in America, right? And that's why it's such a loved holiday in America too, right? Because it brings everyone together.
Right.
You're all sitting together. It's a
Yeah.
good thing.
Yep.
And that's something. My dad was never huge on Thanksgiving. He's like, son, we did that every day in Pakistan.
Yeah,
And I'm like, I don't.
yeah.
Yeah.
Yeah, that's how far we've come, man.
I know.
From it being an everyday thing to make it just a November kind of thing.
I don't know.
Just on the holidays.
Yeah, and I don't know if that's a great thing.
That's
But-
where I'm at right now. That's kind of where
It's
my
hard.
mind takes
It's
me.
hard. It's hard. There's no. I don't think there's any perfect solution either way, though. But we have the idea of capitalism,
Okay.
right? Versus, at the end of the day, what's your definition of success, right? Is
Right.
it just monetary success? Is it happiness in different ways? Is it happiness spiritually, or in your volunteer activities, or in your music, or
Right.
in your art, or in I like making stuff, right? I like working with wood. That's the other thing I do on the side. It's not for money. It's just to make stuff. I just
Yeah.
enjoy making stuff. Sometimes I make stuff for friends when I'm going to their house for the first time, like a housewarming present. Or sometimes it's like something that is for myself. Like I made a pinball machine recently.
What?
In my basement. It's virtual pinball. Don't get me wrong. It's not real. So it's like a big screen in the middle. I can show you some pictures.
Yeah,
But
yeah.
It's wild. It's It was a product of just a love of something that I used to love when I was a kid. And then after I was done with that project, I made an arcade machine too. So I used to love playing arcades when I was a kid.
Yeah.
I'd go to the arcade and play Street Fighter, or play
course.
Excite Bike, and I'd play Excite Bike, yeah. Outrun,
Yeah.
Afterburner, yeah. So these games that I played when I was a kid, now I can play them at home.
Nice.
But yeah, it was fun. It was
Yeah.
a fun project. Yeah,
Awesome.
yeah.
Doctor, well, thank you for stopping by.
Anytime. Thanks for
I
having
wanted to talk, everything that we talked about. More importantly, just the importance of oral health in our community more than
Huge.
anything.
It's huge.
Yeah,
We need to take care of ourselves.
We do.
Our bodies are temple, right?
that's right.
And if we take care of it, we're gonna last longer.
Yeah,
At the end of the day, it's like it's like a car. You don't get your oil changed, that engine's gonna go,
that's right.
right? And think of your cleanings, your dental cleanings, as sort of like your oil change for your car.
It's very simple for everybody that's listening and watching. I mean, imagine everything that goes into your mouth throughout the years and years and years, and if you never flossed it out or you never, did your due diligence, I mean, if you're watching this, it's about that time to go get checked out. Go check it out. Oakbrook Smiles. Dr. Haque, thank you so much.
Thank you. Appreciate it.
It was an honor. It was a pleasure. Thank you for the gifts.
No problem.
Thank you to everybody watching. Go subscribe. Thank you to the team, to Fry the Guy Designs, and to Teresa out in the background back there, and to my post edit guys, my chulo, my guy Georgie. Thank you guys to all the team. La Pura Positiva. You already know the rules. Read a book. Thank you.